So the learning outcomes for today's session. So we're focusing on literature searching for your research project. But after today's session, hopefully you should be able to better identify the purpose of your search. So why are you doing your literature search? Turn your research question into a database search. So you may have an idea of what your research question is, but hopefully by the end of today's session, you'll have more of an idea of how to actually turn it into a research question we can use in the databases. We're going to be talking about using some advanced search techniques, so hopefully you'll have more confidence with using those after today's session. We're going to talk a little bit about where you might search, so hopefully you'll have a bit more of an idea of the databases that you might be searching for your literature search. I'm going to show you how to do an actual search in Medline today, and I'm going to show you how to save that search and set up an alert, and also show you how to find full text articles. And of course, this is only the first part of a two-part session, so next week we'll be building on some of these things and doing some additional work next week. Okay, so before we start telling you how to do a literature search, we just want to acknowledge that it's quite common to have worries or concerns about your literature search, and that's completely normal. And these are some of the things that we hear from researchers when they're thinking about doing their literature searching, and they're worried about a number of different things. And just to say that that's completely normal and that's okay. And hopefully by the end of today's session, we will have covered or answered these questions. So hopefully you won't feel quite as concerned about your literature searching. You may have some concerns in addition to these concerns that I've listed on the slide, and that's okay. And if there are any specific questions or concerns or worries, please do pop them in the chat box or have a word with us at the end of the session if we haven't covered or answered those concerns. But just to say, it's okay, it's normal to have a few concerns about your literature searching, but hopefully by the end of this kind of two workshop program, we'll have answered those questions and you will feel a little bit more confident about doing your literature searching, and hopefully we'll have answered all these questions. But if there are any additional worries or concerns, please do let us know and we will try and answer those in the next two sessions. Okay, I am now going to hand over to Tanya to talk to you a little bit about the planning stage of your literature search.
Thanks, Sally. Hi, everyone. So I'm going to start by talking about planning, because the time you spend planning your search before you kind of hit the databases or hit search engines can really help you to get off on a good start and to save you some time when you're actually doing the searching and the reading. So we're going to go through a few techniques for thinking through your research question and how to turn that into a good literature search strategy that you can then put into practice in your searching. But before I go any further, it's really, really useful at the start of the process of literature searching is to just have a think about the purpose of your literature search. Now, you've all signed up to this session today on literature searching, so I'm assuming that everyone in the room feels the need to do a literature search. Now, pretty much every researcher will, at some point, as part of their research, need to do a large literature search. So what I'd really appreciate is if you can pop into the chat kind of what's the purpose of your literature search? What are you trying to achieve by doing a literature search? And just pop in the chat some ideas about that. It could be for, you know, an overview of the literature. It could be as a part of a systematic review. It might be something else. So just have a go. It doesn't matter. There's no right and wrong answers at this point. I'm just really interested to know kind of why you signed up to the session, what your literature searching is hoping to achieve. This is great. So I'll just read a few out for the sake of the recording. So as part of a systematic review, to see what the current information is and where the gaps are, to find good quality, relevant research, to get an overview of the literature, to help guide my research going forwards. Yeah, to do a scoping review to see what's out there already. So it's useful to start off by thinking, what am I trying to achieve with this literature search? And you may do multiple literature searches. It may be to see what's out there already. So just to give you a bit of a little bit of an overview of the different types of reasons we tend to see, and all of the ones I can see in the chat fall into these, in my view. So we have narrative reviews, and that is usually where you're having a really broad look across all of the current literature in your particular topic area, and as some of you have said, you're trying to get a comprehensive overview of the topic to date, highlight significant areas of research, and identify gaps. Okay, so this is a really kind of a good, you're doing lots of background reading and you're giving the situation as it currently stands, and you're identifying a gap to situate your primary research. Then we've got a scoping review. So again, some of you have mentioned a scoping type review purpose in the chat there. So that kind of gives a preliminary assessment of the size and scope of the available research literature on a particular topic. So it's looking at what literature is out there, what the evidence is for the whatever it is you're researching, and these are usually kind of useful for setting the direction for kind of a research strategy or a policy, and also often used to try to decide whether a full systematic review is necessary in the future. Okay, and then finally, and some of you have mentioned this, we have a systematic review. And a systematic review, for those of you who don't know, it attempts to identify, appraise, and then synthesize all of the empirical evidence that meets a pre-specified eligibility criteria to answer a specific research question. So a systematic review will use very explicit search methods and also explicit synthesis methods. So it might be leading to a meta-synthesis or a meta-analysis. And what makes it systematic is that these methods are followed carefully and they are explained transparently. And the aim of a systematic review, what makes it systematic, is that not only are the methods transparent, but also they aim to be reproducible by somebody else in the future as well. Okay, now all three of these types of reviews will kind of affect how you go about your searching. The systematic review is the one with the most kind of stringent approach, the most stringent methodology, but that you have to kind of publish how you went about your search. But all of them require you to use advanced search techniques and to take a comprehensive approach to the literature. Okay, so what we're going to talk through today is kind of the search techniques that are in common for all these different types of reviews. Okay, so the first thing that you need to do when you're thinking through your research question is, as you saw in the handout, hopefully before the session, is you've really got to work on your research question. Okay, so you think through one of the activities that we had you do before the session, and don't worry if you haven't done it yet, there will be the opportunity to come back to these. But we kind of start with, well, what's my research question? And you can kind of interrogate your research question and think about whether there are any kind of sub-questions that kind of fall off that. So you might start with a question such as the one on the screen. So to what extent do mobile apps and other online tools increase consumption of fruit and vegetables in children? Okay, you might come up with this question. You might think that through more, think about any specific mobile apps, or is it just fruit and vegetables, or is it other dietary changes? Are children my population? What ages of children? And you may have more specific populations in mind. But for the sake of this session today, in this example, I've settled on this research question, or Sally and I have settled on this research question. And one of the first things you do when you're planning your research, your literature search, once you've got your question that you settled on, you try to break that down into the core concepts. And there are usually kind of 3, maybe 4 key concepts in any research question. And in the one that we've got on the screen here, we've broken that down. First of all, the first concept that's in the question is around the mobile apps and the online tools. So we can start to craft part of the search around the mobile apps and the online tools. The next concept is around consumption of fruit and veg. And the final one is our population, that's children. And pretty much every research question can be broken down into 2, 3, or 4 key elements. So we're not worrying about the words like extent of or increase at this point. We're just thinking about the kind of core elements in our question that we can use to build a search strategy. Okay, now in this example that's on the screen, I've just kind of thought through the key concepts. But in health and medicine subject areas and allied subjects, there are lots of different frameworks that you can use to help you think through the different concepts. And there are lots of research papers out there where people such as information specialists or medical researchers, health researchers, come up with some of those useful kind of mnemonics or memory devices or frameworks to help you think through your research question. Because as we know, in health and medicine, there are lots of different types of question. So I'm going to talk briefly through some of these, but I'll point you to some more kind of full advice about research question frameworks in a moment. So this may or may not be familiar to some of you. Some of you may think, oh, yes, I know exactly what this is all about. So don't worry if not, you've got time afterwards to kind of look it up, and you can ask us any questions that you need. So the aim of frameworks used for developing research questions and search strategies is to kind of help to guide you to think of the key elements of the question. So I just did the first one just based on what I thought, and I just kind of broke it down into the key concepts. But in health and medicine, you may see Pico, and this is the patient or population, the intervention, the comparator, and the outcome. And that is a question framework that's really commonly used in medicine to think about effectiveness of interventions or treatments. So it's used in devising the search strategy, but it's also used in the analysis of what you find. Yes, and don't worry if your question looks nothing like any of these. That's also really normal, especially for people who are going into kind of more public health or it's kind of social science type medical or health questions. You may also see PFO, so that is used in kind of prognosis type questions, and that stands, this is where I have to get my notes out, stands for population, prognostic factors and outcomes. So you can break your question down into that. There's many others. I couldn't possibly go on to, oh, thank you, yeah, comparison. Did I say something different? Oh yeah, comparison, right. We've got Cocoa Pop there, and this one is quite a nice sounding one. This is for when you're doing a systematic review for prevalence or incidence of a condition or problem. And so this is the context, the condition, the context, and the population. So these frameworks aim to help researchers think through and plan not only their literature search, but also think through their research question. You may have seen others, so some of you may be doing a kind of cost or economic evaluation of a health intervention. So Eclipse can be useful there. So expectations, the client group or service user group, the location, the impact of the intervention or health service change, the professionals involved and the services involved as well. And the way that you combine these terms together will be kind of honed as you go through testing your search strategy. Okay, so people often find this one a little bit confusing, but don't worry, these aim to kind of help you. Once you've got your head around it, they can really help you to start to kind of break your search down into key concepts. There are some further examples linked from page 2 in the handout, and it kind of takes you through a table of different kind of mnemonics there. And it's really useful to follow up if you are going to use a framework to have a read of the paper where the framework was devised and introduced, just to see how they've applied it in practice. Okay, but to kind of hit back onto some slightly more familiar ground, and I recognise that not all of you will, all of your research questions will fit really neatly into a Pico, but I'm going to talk through Pico first because this one tends to be the one that's used most in medicine. So on the screen you'll see an example of a framework, a Pico framework, and the research question is, are drugs better than complementary medicine in controlling headaches in children? And so you can see we've broken down into 4 key concepts here. We've got the patient, population or problem, and so our patient group is children. Our intervention is drugs, and you would tend to have some more specific drug types or names in there. Our C, which is comparison, is the complementary medicine. So we're looking to compare the effectiveness of drugs and complementary medicine. And the outcome is headaches, or indeed reduction or elimination of headaches, changes in symptoms. So when thinking through our question, we will break down our key concepts using the Pico framework. And it will be the same with the different frameworks you use. You can use those headings as kind of ways to think through your question. When it comes to using this as to build a search strategy, you may not always need to introduce all of these different concepts into your search. You can imagine if you search just for children and those specific drugs and headaches, then you're going to find lots of papers on the different treatments using drugs, using those drugs. If you introduce complementary medicine, you will just find those specific papers that have that as a comparison. But you may not always have a comparison, so it's okay to eliminate. You don't always have to have a comparison. It may just be that you're looking for study like randomized controlled trials where they're looking at the effectiveness of those specific drugs you're interested in. So in this one we've got a comparison, but you don't always necessarily have to have a comparison. And likewise, if you are researching into the effectiveness, the comparison of the drugs or the complementary medicine for headaches with children, it may be that your specific outcomes, so you may have reduction in headaches or symptom improvement or any other really much more specific kind of clinical outcomes. You may not need to include all of the outcomes unless you're looking for just one very specific outcome. So you don't have to use all of the parts of the Pico, just those parts once you've experimented with your literature search that return kind of the best set of results. So just moving on slightly from Pico, all of these kind of research question frameworks that I've mentioned relate to either a specific methodology, a specific review type, or a specific question type. So maybe a qualitative review, a systematic review, or a review of kind of options of treatment. But you may have, as I think some of you have mentioned already, you may have a really different type of research question, and it might actually be the case that it doesn't really fit into one of these frameworks, or you can't really break it down really simply into just 3 or 4 concepts that's going to really capture all of the relevant literature. And so you have got the option, when you're thinking through your research question, to devise multiple sub-questions and then search for each of these. And this is kind of taking a more of a multi-stranded approach or a jigsaw approach to a complex research topic. So the example on the screen here is one that our colleague Deirdre worked through on behalf of a researcher. The example here isn't necessarily, it's not necessarily health related, or it could be public health related, I guess, but that's not important. What is important is the process, which was to actually devise 3 sub-questions and search for material on each of those sub-questions in order to kind of do an overall review of the literature. Okay, and this again, if you are researching something that is more kind of social science based rather than clinical medicine based, you may find doing this multi-stranded approach useful. However, saying that, it's still going to need you to be able to identify the core concepts in each of those research questions in order to kind of make a literature search strategy. Okay, so keeping your eye out for populations and for outcomes or what it is that you're trying to evaluate in the literature and settings, all of that is really, really useful when thinking through your concepts for your research question. Okay, so I'm actually going to give you a little bit of space now, just for a couple of minutes, well, 4 minutes, to have a look again at the handout that we sent and the kind of the concept map that we were talking about. Have a look at your research questions, review it, think about whether you do have any further or sub questions or whether you can refine your question at all. And if you haven't completed your question map already, start to have a look at the question map activity. And yeah, just think through your question and see if you can identify those key concepts. Now, I don't expect you to do this completely fully in a few minutes. Don't worry. This is just for you to spend a few moments having a look again at your question.
Okay, so now we're going to move on to, once you've kind of got more of an idea what your research question is and what are those main concepts, and you might have used any one of those frameworks to try and help you with that, but the main idea is to pull out those main concepts, because that will allow us to then turn this into a database search. So what we need to do now is basically, once you've pulled out those concepts, we need to start thinking of alternative terms or synonyms to describe each of those main concepts. So we go back to our kind of question, our concept map or whatever framework we've used to have a look at those concepts. And I could go to a database now and search for mobile apps and consumption of fruit and veg and children, and I probably would find some research. So that's useful. But I wouldn't find all the research on this topic because I haven't used alternative terms or synonyms. I haven't thought of all the possible terms an author may have used to describe my different concepts. And this is a really important part of the process. This helps us really widen and broaden our search to make sure that we're identifying all the evidence or all the literature on our research area. This is really important. We need to think, once you've thought about your question and what those main concepts are, you need to sit down and have a think about, okay, what are those synonyms or alternative terms? Because we need to add those into our search to make sure that we're identifying all that evidence, because an author might have used slightly different terms to what I've on the screen here, and that means that I need to think about what those alternative terms are. And to do this, I mean, you're all experts in your research area. You probably know the types of terms that an author may have used to talk about your concepts. If you're struggling, you might just want to have a quick search on Google Scholar to try and find some key papers. So Google Scholar or the library search page on our library website. Just put in some of these keywords and try and find some key papers. And then you have to start reading those key papers to see what kind of terms, what alternative terms authors are using to talk about those specific concepts. So thinking about our example question here, and I realise you're not all experts in mobile apps for consumption of fruit and veg in children, but I'm hoping that most of you can kind of understand what this question is asking. So what I'm going to ask you now is to think of some possible alternative terms we could use to search in each of our different concepts. So I think because there's quite a few of you here, I'm going to ask you to just type them in the chat rather than type on the screen. So we've got things like digital technology for the mobile apps concept, yep. Nutrition, diet, balance, kids, yeah. For the children one, there's definitely quite a few that we could use. We've got kids, children, young people, online instruments, healthy eating. So yeah, you've got the idea that this is what you need to do for your own concepts. You need to think of all those possible terms, because this will help us widen our search and be really comprehensive. We're trying to find all the evidence or literature on our topics. So this is a really important part. This is just some of the terms that I thought of when we were developing this search. So you can see that we've got quite a lot. We're starting to really build our search strategy up now. We've got quite a lot of different keywords that we can add into our concept. So this is what you need to do for your search, basically. You need to sit down and spend a little bit of time thinking about what these alternative terms are. This is a really important part of the searching process. So now basically what we've got is a list of keywords, which is fine, which is really good. But now we need to think, okay, how do we actually enter these in the database? How do we combine these in the database? And this is where we start using what's called Boolean operators. And the main Boolean operators that we usually use are and or. Basically, we use Boolean to combine our keywords together. And we always use the Boolean operator or to combine our synonyms together. So within one concept, you combine your synonyms always with or, and then we combine our concepts with the Boolean operator and. Okay, so what this might look like, this is my kind of visual representation of what this search strategy might look like in a database. So you can see that we've used or in each of the concepts. So we're saying to the database, in our first concepts, we're saying, okay, we don't mind whether the author has used mobile apps or digital tools or video games or web pages. We want any of those papers that have any of those terms in. So we're kind of really broadening our search here. We're saying we don't mind which of these terms. We want any of these terms, okay? So you do oring in each of your concepts. You always combine synonyms with or. And then we combine our concepts using and, because now we're trying to focus in on just those papers that cover mobile apps and fruit or vegetables and teenagers or children or adolescents, etc. So always use or to combine your synonyms, and always use and to combine your concepts. So Susanna's asked, do you only have and or? So those are the main ones we use. There are Boolean operators such as not. You may have heard of the not Boolean operator. We recommend that you don't use the not Boolean operator because this usually results in missing out relevant papers, but it completely depends on your topic. And you may consider using not if you're finding that you're getting loads and loads of irrelevant results on a specific issue. You may then say, okay, I'm going to use not. I realize that I might miss out on some relevant papers, but you know, I don't mind that. So we recommend just using and or in the first instance, and then have a look at the results that you find. Okay, so always use or to combine your synonyms, and always use and to combine your concepts. So I'm going to do a demo of this in a second, but before I do that, I'm going to do a quick quiz for you just to check that you've understood the Boolean operators. So I am going to do a mentee quiz, and I'm going to just put the code in the chat. So the first question. So I'm hoping everyone's got into the Mentee. So it's www.mentee.com, and the code is at the top of my screen there or in the chat box. And I want you to look at this first question. So which search string would give us the most results? Would it be well-being and emotional health? Would it be well-being or well-being? So we're spelling well-being two different ways here, and emotional health. Or would it be well-being or emotional health? So which search string would give us the most results? So I can see a couple of people managed to get into the Mentee. Yes, so most of you are right. So the 13 people who said well-being or emotional health, you are correct. That would give us the most results. We're being really broad. We're using or, so we're saying we want any papers that have well-being as one word or well-being as two words or emotional health. So we're being really wide. We're saying we don't mind any of those phrases or words. We want to find all of them. So if you use or, you're being really broad and you're going to find more results. The first one is and. So if you were saying I wanted to search well-being and emotional health, that's a really focused search and you wouldn't get that many papers, I imagine. And the second one, again, we're using or with the well-being, but we're also saying and emotional health, so we're being a little bit more focused. The question, number three, the well-being or emotional health is the most broad search. We're using or for all of them, so well done. Okay, I'm going to go on to the next question. So the next question is, if you were searching for the effects of sleep deprivation on academic performance, which search string would retrieve the most relevant results? So would you use and or not between those two phrases? So yes, you've all got that right. So we've got two main concepts within this. We've got sleep deprivation and academic performance. So those are two different concepts. So we would combine those with and. So sleep deprivation and academic performance would only find the papers that talk about both sleep deprivation and academic performance. The second option, sleep deprivation or academic performance, would bring back papers about sleep deprivation that doesn't have anything to do with academic performance, and the same vice versa. It would bring about papers about academic performance, but not necessarily in relation to sleep deprivation. So if you want both of those concepts in there, we would use and. Okay, and the final question, a few of you have already answered because I started on this, apologies. So true or false, the Boolean operator or is used to narrow your search. Yeah, you've all got it right. So or really broadens our search. We're telling the database we want to find papers with any of those terms in, so it really helps us to broaden our search, and we use and to narrow our search at the end. Okay, thank you everyone for contributing and answering those questions. Okay, I'm going to hand back over to Tanya.
I'm going to kind of move us on now, thinking a bit more about the keywords that you're using. So we need to use keywords. That is the kind of terminology that we are putting into a search engine or a database to find our relevant papers. And I think of keyword searching as trying to anticipate what the other authors or researchers and scholars that are writing about this topic, what words they have used, and we capitalize on their words to find relevant papers. So as well as the Boolean operators and or that Sally's talked about, it's really important to think carefully about the words that you use, the language that you use. There's also some other kind of technical tricks that you can use within the databases to control your search, to bring back exactly what you want. So the first one is parentheses, otherwise known as brackets, and you can use parentheses to specify the order in which your search terms and their Boolean operators are searched in the database. So this is a bit like in mathematics. For anyone who remembers the use of brackets, whatever is contained within the brackets will be done first. Okay, so in the example we've got here, we've got a search, quite a weird search I have to say, but it explains it really well. So we've got cats or kittens as a concept, and horse or foal as a second concept, and we want to return any results that talk about both cats or kittens and horses and foals. Okay, so we can put our synonyms in brackets with combined with or, and we put the and in between. Now when Sally does the demo, you'll see often if you're building a like an advanced search in a database, often the brackets are put in there for you, but it's really useful to know about the power of brackets, because it might be just the thing that you need to control how the search is conducted in a database. So we can use the brackets kind of to control the order in which our search is done. The next kind of tip or trick that you can use when dealing with your keywords is to use an asterisk. So that's the small star, and that truncates the word to help find variant endings. So to put that in another way, it uses just the shortest possible part of the word and finds all words with that end in a different way but start with that part of the word. So the example on the screen is therap with an asterisk, and that will bring back therapy or therapies or therapeutic or therapists or anything else you can think of that starts with therap. So just by using that asterisk, it helps you to broaden your search in the same way that or does, without having to type out all of those different words. Okay. The next kind of tip is the question mark or a wildcard. Now this does vary in different databases, but what the wildcard does is something similar to the asterisk but not the same. So what that does is it gives you the option to use the wildcard character. In this example it's a question mark within a keyword, and that will replace either a different character or no character at all. So this is really useful for British and American spellings. So the example we've got here is the word behaviour, which in US English is spelt without the U, and in UK or British English is spelt with a U. And other variations that are really common are words like organise, where you have an S or a Z. This can be useful for getting more results and capturing variations in how authors write. Okay, now it's worth mentioning here that a lot of databases automate this now, but you can test whether it's working or not, whether you need to use it or not, by trying it and seeing if you get more results or the same number of results using the wildcard or not. And if you get more results, it's worth doing because you're capturing those alternative spellings. So those are just some kind of keyword tricks that you can use as well. Sorry, I'm just going to have a look at the chat. Why would we need to order how the terms are searched? So let me think about this. I'm trying to think of a quick example that I can give you, and it's a bit hard to do on the hoof. I don't know, Sally, if you've got a ready example in your mind.
What we normally say, I know we've put on that slide here that it searches them in specific order. It doesn't really matter what order it searches them in. What we're really trying to do is just group our synonyms together using the brackets. So maybe we have said it specifies the author, but it's the order, sorry, but that it doesn't really matter. What we're just trying to say is you need to group your synonyms together. So the database will search for your synonyms using or, and then combine your concepts together using and. So I haven't really got an example of that. What we're really trying to say is that you just need to bracket or group your synonyms together. It doesn't really matter which order it searches it in. It will do what you're hoping it to do if you put your synonyms in brackets, if that makes sense.
So those kind of, the prior slide was mainly going to be introducing more results into your search. You can also use some searching tips that can help you to narrow or focus your results. One of those is phrase searching. So we saw a few examples from Sally's example search question earlier around healthy eating. So you can use the double quote marks to around your words together to form an exact phrase search. So you can put these in speech marks or double quote marks. For example, on the screen it says young people, and that will search just for results where young people, those two words appear right next to each other. Otherwise, if you just put young people and don't use the exact phrase, the database will pick up results that have young and people anywhere. So they could be 10 words apart. So this is a way to narrow and focus your results and to help improve relevance. Similarly, we have proximity searching, which I did mention earlier in the chat briefly in response to a question. So proximity searching, and these is a kind of a type of operator that you can use in many different databases for when you want to find terms appearing near to each other in the language that the author has used. So for example here, young, ADJ3, so that's adjacent in 3 to people, the word people. This is a proximity search, so that would find all results where the word young is within 3 words of the word people. Okay, and again, so it's a bit more stretchy than the young people in quote marks, which is that exact phrase, those 2 words in that order. Young, ADJ3, people will look for those 2 words in any order within 3 words of each other. So it's going to broaden slightly compared to the phrase search, but it is definitely more narrow than just putting those 2 words next to each other in your search strategy. Yes, exactly. Thank you, Sally. So Sally's put in the chat that this would be useful for finding papers where the author has said young British people, not just young people. Okay, so again, this is useful particularly where maybe you are not finding very much and you want to kind of make it a bit more of an open search, but not so open that you're getting loads of irrelevant results. And that's what literature searching is. It's a balancing act. It's a bit of an art and a science, a balancing act between getting absolutely everything but loads of irrelevant material and getting, or being getting really highly relevant and focused set of results without missing the key papers. So it's always that balancing act. Okay, so we're going to move on and have another mentee quiz now, because everybody loves a bit of mentee quiz. So just as you did before for the Boolean, the first question, which search string would give you a smaller but more relevant set of results? Young people with the quote marks, young people without the quote marks. Great, thank you everyone for tapping the buttons and interacting. Yeah, it looks like the majority of you have got that. Yes, so young people with the quote marks will get you fewer but more relevant results relating to young people. Thanks, Sally. Next one. Which search string would create a search for papers on children and fruit or vegetables? Super. Okay, I think that's the majority of people who have voted. Okay, so you can see in the first one, we've combined those synonyms together with the brackets around with or between. And so the search engine knows to do that or first in the search and then combine it with children. Whereas in the second one, your results would be children and fruit. So all the papers with children and fruit, and then all the papers with vegetables that may or may not be about children. Okay, so that's to explain the brackets. That's really helpful. Thank you. So next one. Which option would find papers using all spelling variations of the word colour? So we have colour, colour with a wildcard, and colour spelt in the US way of spelling. Excellent. Okay, I can see those results coming in, so good. That point has got across really well. We've used a wildcard there, but just to mention as well, if you did a search for colour using either the UK or US spelling, and then put or colour with the UK or US spelling that you haven't used, you would probably see the same number of results. And that's a good way of checking if the database is automatically doing the spelling variations for you. But it's good to know about wildcards because not every database does it automatically for you.
Okay, so before I go into doing a demo on using Medline, I just want to talk to you about one other advanced searching technique that you should be using when you're doing a search in medicine and health, and this is using subject headings. So we've just been talking about using keywords, so that's basically searching for words within certain fields such as a title or the abstract, which is fine, and it will find you lots of literature on your particular topic. But when we're searching in medicine and health, we also need to use this searching technique called searching for subject headings, or MESH. You may have heard it called MESH, or subject headings, or thesaurus terms. So before I just explain why we need to be using these, I want you to look at this picture, and I want you to put in the chat how you would describe this image. So just have a look at this little picture and tell me how you would, what word or words would you use to describe it? Okay, thank you. Just any excuse to use a cute picture of a dog, but you can see that we're all looking at the same image here. We are looking at a little picture of a dog, but we've got lots of different ways of describing it. So we've got dog, we've got pug, we've got puppy, we've got cute. So you can see that I'm using this to show you that actually we're all looking at the same image, but we're using different words to describe it. And this can be what can happen when an author writes some research about a particular concept. They might be writing in relation to a particular concept, but they might use slightly different terms to describe it. So that's why we think about using those different synonyms. But sometimes we might not think of all the possible synonyms an author might have used to describe a particular concept. And because of that, we might miss out on some research if we're just using our keywords. So here is why we need to be using subject headings. Subject headings are kind of similar to using hashtags. So if you use Instagram or Twitter, you may in Instagram post a picture of a picture of something, and you might use a hashtag that will allow most people to find your image. Okay, so it's kind of similar to that. So we use these within our database searching, because these subject headings, they describe the contents of an article, regardless of how an author has used to describe it. So for example, there might be a paper about fizzy drinks. So we might think about using keywords such as fizzy drinks, soda, or carbonated drinks. But also we can find the subject heading for fizzy drinks, which is actually in Medline carbonated beverages. And we can add that into our search. So no, we're finding those papers where our author has used our keywords, but we're also finding all the papers about fizzy drinks because it's had this subject heading attached to it. So we're being really comprehensive. So because we might not have thought of all the possible synonyms an author might have used, that doesn't matter because we're also using that subject heading to really catch all those papers. It just supplements our keyword searches and makes it more comprehensive. Unfortunately, we can't just rely on subject headings because some of the newer papers that are put on the databases won't have had those subject headings attached to the papers. So we still have to use our keywords. So we have to use our keywords, our synonyms, but we also need to use those subject headings to make sure we're finding all of the research, all of that literature on our particular topic. So in Medline, they're called MESH, which is short for medical subject headings. Other databases just call them subject headings or thesaurus terms. So most of the big medical and health databases use these subject headings. So Medline, Embase, CINAHL, PsycInfo, these big medicine and healthcare databases use subject headings. Unfortunately, they all use different subject headings to each other. So you can't just develop your Medline search using subject headings and then run that in a different database. You need to find the subject headings in each of the databases that's relevant to your concepts. So this is just an example of an article in Medline. It's about lung cancer screening from 2008. And at the bottom of the screen here, you will see these are the MESH, these are the subject headings that have been attached to this particular paper. So it's got the MESH heading about early detection of cancer, it's got lung neoplasms, which is actually the subject heading for lung cancer, it's got mass screening, etc., etc. So it's got lots of different subject headings. So for each of your keywords, you need to be looking to see if there is a subject heading for your particular concept. Okay, so this might not make loads of sense to you yet, but I'm going to do a demo now in Medline to show you how to find keywords and how to find those subject headings and how we can combine all of those using our Boolean operators. So if you just want to follow what I'm doing first, and then you can see how I'm doing it, and then we'll give you a little bit of a go. So I'm just going to share my screen with you. Okay, hopefully you can see my screen. I'll just try and make it a little bit bigger. Okay, so this is the library homepage, and this is where you can get access to all of our databases. Okay, so this is the place that you need to come to access our databases. So we're going to be looking at Medline today. So in the search box, and to get to the library website, you can remember the web address, which is library.leeds.ac.uk, or you can just Google Leeds University Library, and it'll be the top one that comes up in your Google results. So you just type the database into the search box. Today we're going to be searching Medline, which is one of the biggest medicine and health databases, and click on the search button. And it basically gives us a suggested database here at the top, which is usually the right one, and you just need to click on Go to Medline. Okay, so Ovid is the company that provides access to a number of different databases. So Ovid isn't a database in itself. Ovid is a company that it's not a company. Ovid is a platform that provides us access to a number of different databases. And in here, you will find Ovid Medline here. So I'm just going to click on Ovid Medline. It goes back to 1946. And all of the Ovid databases look very similar. It'll look like this, okay? So we need to be going to our search box here, and I'm going to just first of all start off by searching for our mobile apps concept, and I'm going to be searching for our keywords, and I'm just going to make it a little bit bigger. My first concept is mobile apps. I'm going to search for some keywords. So I'm going to bracket my keywords because I'm going to put them all together in one line. I'm going to put mobile app. I'm going to use truncation because it could be applications, app, or apps, or video game, could be games, or online tool, could be tools, or digital tool. Okay, so I've put my keywords to do with my first concept in brackets. Now, in the Ovid databases, you don't have to put speech marks around your phrases. But if you did, it wouldn't make no difference. You might want to put speech marks around each of your phrases. It won't make any difference, but if that helps you, that's fine, you can do that. But in the other databases, you don't need to. Okay, so what I'm going to show you now is a little bit of an advanced tip. Okay, so if you just want to search for your keywords in the title or the abstract, you can actually tell the Ovid database Medline to search the text word field. And the text word field is the title or the abstract field. Now, it's not very intuitive, and don't worry if you don't remember this, but how you do that is you basically just type .tw. Unfortunately, there's not a nice drop-down box where you can select title or abstract. If you do, it'll just search a number of different fields, so it will just be slightly broader. But if you do want to just search the title abstract field, you just need to put .tw, which stands for text word field. But don't panic if you don't remember that. It will just search a few additional fields to the title and abstract. So I'm going to click on the search button. And at the top of my screen, it should, oh, it's just taking a little bit of a long time. There we go, it's done our first search step here, which are keywords for mobile apps. So now I would try and find a subject heading for mobile app, for video game, for online tool, for digital tool. I'm just going to try and find a subject heading for one of those, just because we haven't got time to do each of them. So I'm going to try and find a subject heading for mobile app. Okay, so what you do here, you type in mobile app. You don't need to use truncation when you're searching for a subject heading. The difference here is I'm going to tick on this map term to subject heading box. So we're telling the database we want to see if there's a subject heading for mobile app. And I'm going to click on the search button. Okay, so now the database usually gives you a list of suggestions of subject headings that it thinks might be relevant. This time it's just given me one because it's quite obviously just this is the right one for me. So I'm going to click on mobile applications here, and it takes me now into this list of hierarchical subject headings. So you can see here that mobile apps is a narrower term of software, okay? And software is a narrower term of computing methodology. So it kind of goes down in hierarchical order, and it will highlight your one. Sometimes it's useful just to look around here and say, okay, well, maybe this one might be relevant to me, or this one. You need to make that decision for yourself. But I'm just going to choose mobile apps. I can actually see here there is a video games one here too, which you might want to choose now or when you search for the video games one. So I'm just going to leave that selected, scroll to the top of my screen and click on continue. On this next page, just ignore the subheadings. We don't really need to use these, so I'm just going to click on continue again. And you could see that it's added my subject heading in for mobile applications there. So as I said, you would search for subject headings for each of these. There isn't a subject heading for absolutely everything, so you may not find one for each of these, but it's worth searching for. So what I'm going to do now is I'm going to combine 1 and 2, and can I ask you to suggest whether I'm going to combine it with and or? Do you want to put in the chat box? Yeah, it's or, because they're both within. Okay, some of you have chosen or, some of you have chosen and. So because these are within one concept, we always combine with or. So we're saying we don't mind whether we find articles with any of our keywords in, but we also don't mind if we find articles that have been indexed with the mobile apps subject heading. So they're all within one's concept. So you would always combine with or, okay? So all I'm going to do is tick on the or box. Okay, I'm going to move swiftly on to my next concept. So this is my fruit or vegetables. So I'm going to put fruit or vegetable or healthy eating, which is slightly broader, isn't it? But you need to decide. Healthy diet. I can't type when people are watching me. Improve nutrition. Okay. So again, I've bracketed those. I'm going to do .tw docs. I just want to search in the text word field, which is title or abstract, and I'm going to click on the search button. And then it's put my keyword search here for fruit or vegetables or healthy eating. I'm now just going to try and find a subject heading for fruit. So again, just type fruit. My map term to subject heading box is ticked already, so just search. This time it's given us a few different options. So this is where you might have to look at each of these, but I'm guessing this is the right one for me. I'm going to click into fruit. scroll down, and if you're unsure whether this is the right subject heading, there's a little scope note, it's called, this little I button, and this just gives us a bit of information. So if I was to click on that, it's saying, okay, this subject heading is for fruit, and the fruit is the fleshy or dried ripening over river plant. So this is, if you're not sure whether it's the right one, you need to click on the little I button. I'm assuming that this is the right one. You may want to include nuts and seeds, or you may just want to include the fruit. So I'm just going to include fruit. I'm going to scroll to the top and click continue. Ignoring the subheadings page, click continue. And now I am going to combine my keywords for fruit and veg with my subject heading for fruit and veg. And what am I going to combine it with? Yeah, or. So I'm going to click or because they're both within the same concept. And finally, I'm just going to do my child keyword search. And in this one, I'm going to try and use a proximity. So I'm going to put this in another set of brackets. I'm going to put young ADJ2 people. Okay, so I'm just saying I want to search for child or preschool or teen or adolescent, or the word young within 2 words of the word people. So I put that in brackets so the database knows to group that together. And I put it all in brackets. I put .tw, click on search. It's done that search for me up there, and then I'm just going to try and find a subject heading for child. I'm going to put child, map term to subject heading, and search. It's got lots of different ones this time. This is probably going to be the most obvious one for me. Click on child, scroll down. Yes, it's definitely the one for me. You can choose whether to add in your child preschool. There is an infant one there and an adolescent one there. So this is where you need to do a bit of thinking about whether you want to include those. So click continue and continue. Just going to click on expand here so I can see all of my search steps. I'm going to combine 7 and 8 using or because they're in the same concept. And can anyone guess in the search box what I'm going to do next? Yeah, so we're going to get our final search step for mobile apps, which is 3. My final search step for fruit and vegetables, which is 6, and my final search step for children, which is 9. And this time I'm going to combine with and because I want to now focus my search, just find those papers that mention all 3 of my concepts. And you can see that from the large numbers we were getting, I've now got a very small set of 137 papers that mention either mobile apps, fruit and veg, and children. So we've got down to a more manageable amount. I'm going to scroll down and here are my results. And it's quite useful because it highlights my search terms in yellow. This is where I would probably start to go, okay, this looks like a really relevant paper. Let me read the abstract. And it might bring me through to some more keywords that I then need to go and add into my search. So searching is quite iterative. You might do an initial search, look at some key abstracts, and then go back and add in some extra keywords. So this is where you do a little bit more reading. Okay, so you can search the abstract. And if you, once then you'd finish your searching, you thought, okay, I want to check whether these papers are in full text. You might think, okay, this is a really key paper. This looks really great. The abstract is really relevant. I want to see whether we have this in full text. So this is where you need to be looking for the check at leads button. In each of the databases that we subscribe to, there will be check at leads buttons by each of the results here. So if I wanted to check this first one, to check whether I had full text access, I can click on the check at leads button. What it does, it links through to our library system, and it says, yes, we have this paper, and it gives me the download PDF link. And if I click on that, it never works when I'm demoing it, but we'll see if it works. Fingers crossed. It should take me through. Yes, it's given me the full text paper. So what you need to be searching for is that check at leads button, and just check whether we have that full text paper. Okay, once you've done your search and you're happy with it, you need to make sure you save it, okay, in whatever database you're in, because you need to keep a record of your searches so you know what you've searched, when you've searched it, and how you searched it. So in each database, you will be able to set up an account and save your search. So in the Ovid databases, all you need to be doing is click on the Save All button here. There's usually a save search history or save all button or save search button around your search steps in whichever databases you're in. But in the Ovid databases, it's here, save all. And what it will ask you to do, if you haven't got an account in Ovid already, you just need to click on create account. And then whenever you're in any of the Ovid databases, you can just log in that and save your search. So I'm just going to click login here. And what you do, you give your search a name, and you can choose here whether you want to set up an auto alert. So an auto alert is really useful if you want to be kept up to date with any research that gets published that matches your search. So any research that gets put on the database that matches your search, you will get an automatic email, which is a really useful way of keeping up to date with any new research that matches your search strategy. So you just need to fill in some details if you want it in email, how often do you want it, and all you do is give your search a name and click save, okay, and then it'll save that search. So whenever you're in the an Ovid databases, if you want to see your search again, you just need to be scrolling to the top and click view saved here. And if you view saved, you'll get through to all of your saved searches here. Okay, and then you can run your search, view your search, and it's all stored and saved in there.
Sally, just to chip in while you're sorting the slides out,
yeah.
We haven't got those steps around combining the sets in the search history or the setting up alerts in the handout. So I think I'll offer to make some step-by-step instructions for us to circulate and append, and anyone who wants to go over that again will need to just look at the recording until I've done that.
Okay, we do actually have an advanced Medline searching guide, so which does
brilliant.
show you all that. So we could maybe just link to that in the email after the session.
Perfect, thank you. Thanks for that.
Oh, and I've just seen that Simon's just asked about limit, so I'm just going to share my screen again and just briefly mention about the limits. You can limit your search. I can't speak and do at the same time. Hang on. Okay, in all of the databases, there will be limits that you can add to your search. So you can see we've got our 137 papers here, but you may feel, okay, I might want to add a publication year limit. So if I was only looking at the last 10 years, for example, or there's English language or review article limits here. But within the Ovid databases, there is quite a lot more limits that you can add into your search as well. So all you need to do is click on additional limits here. And it says which search step do you want to limit, which is usually your final one, which is what it's defaulted to. And you might want to spend a bit of time looking through all these limits. There's some useful ones that we use quite a lot, and some other ones that maybe you won't use at all. So these ones are quite useful if you're looking at a specific type of kind of research. If you're looking for review articles, or you're looking for articles that focus on the therapy or the diagnosis or the prognosis, that those can be quite useful. We have added our age group into our search already, so we don't need to add this on. But if you just search for mobile apps and fruit and veg, but you didn't add in that child concept, you could use the limits here. So there's lots of limits that you can add in here. Have a look at them. Don't add limits just because you can't be bothered reading all the papers. You need a really good reason for limiting your search. So do have a look in here if you do want to add. But if you did want to use any of these, you would just select the one that you wanted and scroll to the bottom and click limit a search. And I'll see what happens to my search now. So actually only 9 of those papers were reviews. So yeah, it just gives you an example of how to use the limits. Okay, I'm just conscious of time, so I'm just going to go back to my slides. Can't remember how much more we've got to fit into the session. Okay. Just before we move on, okay, once you've clicked that check at leads button, if it says we don't have access, there are some other options. We do spend millions of pounds a year on journal subscriptions, so hopefully we will have access to most of what you need. But if you don't, there's a couple of options. We do have the document supply service. Unfortunately, that costs you £10 per request. It costs us more than that, so we don't pass the full cost on to you, but I appreciate £10 is not an insignificant amount of money. So that might be your last resort. If there's like a really key paper that you just cannot access any other way, there is a document supply service. We do have some schemes. We have the Sconnell scheme, which includes many HE libraries around the UK that allows you to access their library. So if you do live near a different library, you may have a look, see if they have access to the resource that you need. We have a really great scheme with the University of York and Sheffield, which basically gives you PGRs the same rights to access as if you were a PGR at Sheffield and York, so you can go and access all of their content, and I think it includes all the online stuff as well. Yes, I think it does include all the online stuff, Susanna. It's a really great scheme. Just click on the link on the slides, or it will tell you how to access these, but it's usually just contact the library, the customer services in the library, and they'll sort out that for you. Of course, there's other public libraries that you can access. You can try contacting the author and asking for a copy. They may be able to, they may be willing to share that with you. They usually have the right in terms of copyright to share those on an individual basis. And do check Google Scholar to see whether we have the full text version. The full text version has been deposited in other institutional repositories. So the great thing about open access now is that a lot of these results are being made available open access in institutional repositories. So, you know, do check on Google Scholar, which usually searches all of those institutional repositories. Okay. I'm going to now go on to passing on to Tanya. We were going to give you a little bit of time to find a mesh heading, but because we're kind of running out of time a bit, I'm going to go straight on to thinking about which databases you search. But after the session, have a log into Medline and see, have a go of it and see what you think, and you know, you ask us any questions if you're struggling after the session. But I'm going to pass over to Tanya to talk to you about where to search for information.
Thanks, Sally. So yes, before I start talking, I'd really be interested to know from you, where would you normally search for information of this kind? So we've been mainly talking about journal articles reporting on studies. So if you don't mind, and there are no wrong answers here, so please do just type in the chat, where would you normally go for this kind of information? So we have library search, Scopus, CINAHL, which is a nursing and health database, Google Scholar, Web of Science, Google Scholar, Sci-Hub. Anyone else? Google Scholar, PubMed, the University Library, Medline, Google Scholar, Leeds Library Search. Thank you for popping those in. So those are all good sources, and PubMed is mentioned there as well. So some of you have mentioned some kind of broad and interdisciplinary sources. So for example, Google Scholar is easy to use, it's free to use, and it covers all disciplines. And Google Scholar can be useful if you're just starting out. I would say about Google Scholar, my main caveat, and I do use it too, but one caveat I have with Google Scholar is that you're not certain what it's covering. So it may omit some really important sources, and there's no way of checking. So Google Scholar's good if you just want to kind of test out some keywords or get some ideas about what's out there. And you can use advanced search in Google Scholar as well. Similar is library search. So I think library search is brilliant, but like Google Scholar, you're going to find large quantities of results coming back. There are some filters in library search, and there are advanced search features too, but it's covering all subject areas. So if you want to narrow down to particular types of information or particular subject areas, then you're likely to need to use databases such as Medline, which we've had mentioned, PubMed, which is like a free version of part of Medline, and Web of Science is another interdisciplinary one, and we have CINAHL, which I mentioned is for nursing and allied health, so not just for medicine but going into nursing, physiotherapy, and so on. Great. So you might be wondering, well, how do I know, oops, I've gone too many. How do I know what's out there for me and what the university library subscribes to on my behalf? Well, I'll point you to the university website. I might just have a go at trying to share my screen because Sally's done all the sharing up until now, but I'm going to have a go. So hopefully you can see my web browser here. So this is the library website. Sally showed you earlier typing in the name of a database such as Medline into the search box. But if you scroll down from the search box to where it says Student Essentials, we have a link through that says Subject Databases. And no matter what your subject area is, if you click on Subject Databases, you'll find all of the key subjects covered here at Leeds. And you can scroll down and you will get through to see a list of subject databases. You can use the A to Z, or you can use the search box, or just scroll. I'm just going to click on M for medicine, click on medicine there. And this is a list of the key databases, not necessarily every database, but we've got key databases. Databases may be arranged around the type of information as well as the subject area. So if you are looking for example, clinical trials and systematic reviews, we do have some separate advice for searching for those specific types of information. But the key databases are highlighted further down the list. I can zoom in, yeah, okay. Hopefully that's a bit bigger for you now. So you can read a short description of the different databases and what they cover. You don't have to search them all, and I would say that 5 databases is going to be very comprehensive for you if you choose a range of databases. Also, if you're searching in health and medicine, we often find that the key medicine databases such as Medline and Embase and CINAHL are really good as the core search databases, but you might want to add, say, one interdisciplinary database such as Web of Science or Scopus, and depending on your search question, you might need to go into another subject area. So for example, if you're looking into health education topics, then the medical databases will definitely include subject matter on health education, but you may also want to have a look at the list for education and choose 1 or 2 education databases that are specific to education. And that applies across different subject areas as well. So just be aware that not everything will be in the field of medicine. You may, if you're doing something interdisciplinary, go outside of the medical databases. Okay, so I'm going to try and go back to the slides now. Just bear with me a moment while I do that. So I'm not as slick as Sally at doing this part, but I'll get there. Okay, so let me go back to where I was supposed to be. So that's summing up where you find the databases. So again, what I think I will do is just give it back over to you just for 5 minutes. We haven't got that long left in the session, but go and have a look. If you're not already doing that already, just go and have a look at the subject page for your subject area or an aligned subject area to your research question from the library website. The link is there on the screen and I can post that in the chat, I think. Scroll down to Student Essentials and click on Subject Databases. Okay, we'll just give you a few minutes to do that, and you can pop in any questions you have about choosing databases into the chat if you want, or raise your hand. So what you're doing at this point is hopefully popping in to the library website. I think it's probably best at this point to give a little bit of space now for us to just talk about what's going to happen in the next session, because there are a few things to do to prepare for the next session. So what we would like you to do is to start developing your own search strategy. So that is looking at the subject, the key concepts, looking at the synonyms, having a look in the databases for any subject headings. And we'd really like you to share with the group, so it's just this group, it's not going to go out publicly, it's just for this group, how far you get and what your thoughts are. So we shared in the email before the session, there's a kind of a sway which kind of looks like a little mini website, and it gives you the links to the search plan. And also a Padlet. So Padlet is just an online space where we can collaborate. So what we'd like you to do is look at the search plan template and start to try to fill that in as best you can for your research question, or consider your, some sub questions. Maybe just choose one of those sub questions to focus on for this exercise, and then upload the thank you, Sally, for sharing that. So this is the search plan document that's linked from the SWAY, the session information. So you can put in your topic or question, you can start to generate your synonyms. You can do a little bit of initial searching. If you're not sure what synonyms to use, that's absolutely fine. Just start to build up a table of synonyms under each concept heading. Have a think about your search operators as well, so how you would combine those together, whether you're going to use any of those tips and tricks that we mentioned, so the truncation, the wildcards, phrase searching, or proximity. Do consider any limits. So Sally pointed out the date range limits and the language limits, but also if you're looking for really particular types of material, this is a good place to consider that. So reviews, randomized controlled trials, other kinds of cohort studies, or whatever it is that you think is necessary to get relevant results. And then explore those subject pages and the grey literature pages, which we haven't mentioned, but you're welcome to have a look at on that table there. And just do your best first shot. Having done a bit of thinking, yeah, just post to the Padlet. So the Padlet is linked from the SWAY, and it looks, as Sally's showing you on the screen, it looks like this kind of orange, kind of fiery colours there. And to add to the Padlet, you just need to go down to the bottom right where the plus icon is and click. And you can enter a heading, you can upload a document. As Sally's showing you there, just click on upload, and you can put a Word document or anything else, and then click publish, and it will pop up on the middle of the screen. Okay. You can also pop any questions that you've got, and we can put some answers on there, or we can go and do a bit of searching around for answers if we don't know, because we don't know everything. And we can post things back onto the Padlet as well. Let me.
Tanya, can I just jump in there? So
please do, yeah.
If you once you put your search plan on the Padlet, one of the benefits is that Tanya and I are going to give you individualized feedback on your searches. So we will keep an eye on this Padlet up until next week's session, and we will put comments on your search strategy. So once you've added it to the Padlet, we can add comments just below it. So yeah, if you do want us to give you individualized feedback on that, fill in the search plan, upload it to the Padlet, and we will keep an eye on that and put our comments on before next week's session. Yeah, if you upload it like the day before the session, we might not have time to give you feedback until after the session. So just bear that in mind. But yeah, if you do, please put them on there. You know, we're really willing to have a look at your searches and give you some feedback. Yeah, if you have any questions, do just get in touch with us. Our email addresses are at the end of the slides there. Does anyone have any specific questions about the work, or you've got the link to the SWAY now, which has all the information on there that you need. It has links to the search plan, it has links to the Padlet, so hopefully that's going to be clear what you need to do, but we will also be sending an email out after today's session. So just before we finish, so we do have one more session next week, and next week we'll build upon what we've learned today, but also give you some additional techniques to make sure that your search is really comprehensive. So we're going to start off the session next week, first of all, talking about potential biases in the scholarly information and within literature searching, and what that you need to be aware of these biases, and what can you do to try and mitigate those biases. What can you do to make sure that you're hearing from all everyone's voices rather than just a select few, kind of privileged few. So we'll be talking about that. Tanya did mention grey literature just then. We're going to talk more about grey literature next week, what it is and how to search for it. Searching for grey literature can be a brilliant kind of additional thing that you can do in terms of searching for information. So today we talked about your database searching, but grey literature searching is slightly separate from that, but it's an additional thing that you can do. We're going to talk about a few extra additional searching techniques. We're going to talk about text mining and some other techniques that you can use within medicine and health that can be quite useful. We're going to talk about translating your search strategy. So today we've talked about how to develop a search in Medline. Obviously you're going to be searching more than Medline, so how do you translate that search within the different databases? And we're going to talk about how you evaluate and make sure that your search strategy is fit for purpose and that it's finding those key papers. And we'll end next week's session just talking about writing some search method text. So if you are publishing your research, or even if you're just doing it for your thesis and publishing it in your thesis, you may want to think about writing some search methods text. So that's what we'll be doing next week. But please do have a look at that search plan. And if you do want individualized feedback, please pop it onto the Padlet. If you have any questions, please email us. My colleague Deirdre is on here too because she runs this session along with Tanya and I, but if you need anything, just email me or Tanya and we'll get back to you. But thank you all so much for joining in today's session and being so interactive and answering all our questions, and good luck with the search plan. And if you have any questions, just let us know. But other than that, we will see you next week, same place, same time.
Thanks everyone. Yeah, do your best, but don't worry about the search plan. It's all just a learning process. Thanks, Sally, as well. And I'll pick up on a couple of the questions outside of the session as well, and post answers on the Padlet. Yeah.
Yeah. Okay.